everybody. Uh, I want to welcome you all to tonight's presentation. Tonight's instructor will be Jacqueline. All right,
Hello,
I just
everyone.
want to let everybody know that we will be recording tonight's presentation. So, just so you guys are aware of that. All right, so Jacqueline, take it away.
Alrighty. Hi, everyone. Good night. How's everything going? Um, so my name's Jackie. I'm a registered dietitian. My business name is the Right Bite Nutrition Counseling. We are located in Miller Place. So today we're going to be talking about the immune system, kind of fitting for this year with everything that's going on with COVID, and basically how our diet can impact it. Um, so just a little bit in terms of the practice. Like I said, we have our practice located in Miller Place. Currently, with everything that is going on with COVID, we're operating via telehealth. So that's been really convenient for our patients, keeping them nice and safe, our staff safe as well. So it's myself. Again, I'm a registered dietitian. We also have another dietitian, Kim, that works for us as well. And basically, we cover nutrition concerns for all ages, health concerns, um, between diabetes and then any autoimmune issues, metabolism problems, things along that line. We do accept health insurance, and most of the time, our patients are covered at 100% no copay, which is really great. So it's definitely a benefit that I would check from your health insurances and see if it is something that's covered. So I always like to start all of my presentations with this little visual. So basically just on the difference between a dietitian and a nutritionist. Most of us aren't really too familiar with the difference. It kind of gets thrown around a lot. We're usually used as interchangeable counterparts, but there is a pretty significant difference between going to a dietitian versus a nutritionist. So as you can see here, there's a little bit more in terms of qualifications, legal status of our degree. We are, there we go. We are registered. So that is why we're covered by health insurance. Versus a nutritionist, not to knock on them at all, but just a little bit less knowledge in terms of what they are able to do and not do. We're skilled in something called medical nutrition therapy as dietitians. So basically what that means is we're skilled enough to take a look at anybody's past medical history, the medications that they're on, if any, vitamin supplements, basically their whole backgrounds of their medical history, and then provide professional advice in terms of what would be the best route for nutrition therapy for that individual. All right, so jumping into the immune system, basically a robust system that defends us from outside foreign substances such as bacteria, viruses, and parasites. There are two types of immunity. So we have innate immunity. You can kind of think of that as the guard. So it's basically our bodily protective barriers like mucus, sweat, stomach acid, etc. And then we have our adaptive or acquired immunity. So that's going to be, I kind of refer to them as the secret spy agents. They're able to recognize an outside substance and then formulate an immune response based off of that. So similar to COVID in this case that's circulating around, when a foreign substance enters the body, these cells and organs create antibodies and lead to multiplication of immune cells. So factors that reduce immunity, we have our age. The greater our age, the lower our immune function tends to be. That's going to be because we are having less efficient organs, especially our thymus and bone marrow. They're going to produce less immune cells and less of immune response. Another issue in terms of greater age is that in terms of micronutrient deficiencies, they tend to be a little bit higher in the older populations, sometimes just related to not enough food intake. So if you know anybody that's a little bit older and it's kind of tough to get them to eat their food or they forget, that could be part of it. And then also they're just not utilizing the micronutrients as well. Excess weight can also reduce immune function. So usually when we have an individual that's overweight or obese, there's going to be a little bit more inflammation in their body. There's still very new research on this topic, but one thing that's really, really interesting is for the flu and COVID, basically there's an increased risk factor of impaired function of our T cells, which is a type of white blood cell. Stress can impact pretty much anything in the body. That can also impact our ability to lose weight if we're talking about weight loss. Generally speaking, if you're having more stress, cortisol, which is our stress hormone, will rise, and then that causes more inflammation in the body, which again isn't a great thing if we're trying to ward off a particular virus, bacteria, disease. Environmental, you can think of alcohol, smoke, air pollution. I know if you're anything like me and my family, you might be doing a little bit or having a little bit more alcohol than you generally were in the past. So that's something to also consider as well. If you are, having a little bit more alcohol, or again, smoke, air pollution, things like that can also impair your immune function. If we are not getting enough sleep as well, that's our body's time to really restore and work on repair. So if we're not getting adequate sleep, typically that's less than 5 hours per night, generally we're going to see a reduction in immune function as well. And then the last one's poor diet. So we're going to get real nice and deep into this risk factor and talk about that today. All right. So poor diet and the immune system. Nutrients, as we know, if you think about like emergency tablets and airborne, that's gotten really popular, they play a vital role in immune response. So there are a lot of cofactors and responsible for a lot of processes in the body. The main thing to take away from today is balance. So balance is key with everything in our body. Our body likes to be in balance. It strives for homeostasis, if you remember that word from science class years ago. If we are overnourished, which kind of sounds like a good thing, but if we're experiencing overnutrition, obesity, or even malnutrition, the opposite of that, both actually have been shown to negatively impact our body's immune response. Even mild deficiency of single nutrients have been shown to impact immune response as well. So we really like to be within normal limits of all of these different types of micronutrients. We do know that poor dietary habits basically increase inflammation in our body. And again, that's that response that we really don't want, because that's going to impact our overall immune system. So when I talk about inflammation, what is inflammation? So Merriam-Webster dictionary has a really robust definition: a local response to cellular injury that is marked by capillary dilation, leukocytic infiltration, redness, heat, and pain. So basically, it's our body's response to something that it really doesn't want there. So there's acute and then there's chronic inflammation. So you can kind of think of acute inflammation as, if you cut your finger, for example, and now it's a little red and swollen, that's your immune system dispatching the white blood cells and surrounding the area. That's actually a pretty similar response that our body sees to the flu, for example. And then there's chronic inflammation. So that's going to be any chronic diseases. So for example, diabetes, that's inflammation. Any arthritis, anything along those lines would be considered inflammation in the body. So inflammation instigators, things that we're doing in terms of a dietary component that could be causing more inflammation that could already be there. That would be all the good stuff, right? Of course, it's all the good stuff. Fried foods, added sugars. And that can be from a multiple different sources: sugary drinks, candies, baked goods, refined carbohydrates, which would be all of the white stuff. So white bread, white rice, white pasta, white flour, processed meats, So salami, bologna, sausages, and then excess saturated or trans fat. So this one's usually a surprising one for most folks. Trans fats are actually pretty readily available in things like Jif or Skippy peanut butter. So that's something to take a look at on the back of your label if you have that at home. Take a peek at it. If you see something that's listed in under the ingredients as hydrogenated oil, that is the keyword for trans fat. The FDA allows for 0.5 gram and under to be listed as 0. So if you look at the label, it'll say 0 grams, but if you're having more than the serving and you're having that pretty frequently within the course of the week, not necessarily the best for our body. And then the last one is alcohol. All right. So now that I depressed you all with the poor food choices, there are some really great things though that we can be doing in terms of diet function and how we can really rev up our immune system. So our MVPs, our most valuable players, are going to be vitamin C, vitamin A, D, E, zinc, protein, and probiotics. Those are going to be the main ones. There's much more that I could have included today, but these are going to be the main MVPs going on in terms of diet and immune function. All right, so this is a really great visual that Harvard Medical put out. I really like it. It's a great way of just kind of summarizing everything. So we have our anti-inflammation foods, which is generally going to be our fruits, vegetables, our lean proteins, our healthy fats, nothing that most of us haven't heard. And then you have your pro-inflammatory foods. So again, those fried foods, soda, refined carbs, lard, processed meats, alcohol, things along that line. So we're going to play a little game. If everybody has the chat button open under their Zoom, I'd like to go through just kind of like the common myths that are associated that you hear a lot in terms of immune function. So this will be fun if we're all participating. So we're going to go through some true or falses and we'll go through all of this. So true or false, if I'm overweight/obese or losing weight rapidly will boost my immune system. What's everybody thinking? False. False, a couple of falses in there. Okay, all right. False. Okay, good amount of false. All right, so everybody is right here. So this is definitely why we want to be careful with fad diets. And someone in there, yay, I like that. Careful with fad diets that promise, very strict regimens where you're going to lose 10 pounds in 2 weeks or something crazy like that. Whenever our body's losing weight at a rapid rate, which we would consider to be, generally speaking, this isn't true for everybody, but generally greater than 2 or 3 pounds per week would be considered rapid weight loss. Now, if we're rapidly losing all of this weight, generally speaking, it tends to be because of restrictive dietary measures and maybe over exercise, which are all things that can also throw our body off balance. Remember, balance again. So anytime we're creating more stress for our body, which would be a very high calorie deficit because of over exercise or because we're restricting our calories to the extreme, it's not going to be the best for our immune system and our immune function. Great job with those answers. All right, so true or false, sleeping 7 to 9 hours per night will support my immune system. What do you guys think? True, true, yep. Perfect, all right, good. Smart group of people. All right, so true. Basically, again, sleep is going to be our major area where we're restoring. So it's going to help with our response against bacteria and viruses. True or false? You can boost your immune system. What does everybody think? True. I have a couple trues in there. Anybody else? A false in there? True. All right. False. So this is my trick question of this game, and I wanted to put it in there because there's a lot of miswording that goes on for supplements and just a lot right now, especially with COVID being around, of what companies are promising. So again, it was a trick question. It's false because technically speaking, a boost in the immune system would not be a good thing. So again, balance. So a hyperactive immune system would actually be a bad thing. That's usually if you see any autoimmune disorders, that's generally what's going on. They're having a hyperactive immune system. So we can't really boost our immune function, but we can support it. So making it work as great as it can, giving it all of the things that it needs to function properly versus really trying to overdo and make that immune response too like hyperactive, basically. It was a trick question though. All right, so true or false, more is always better when it comes to taking vitamin C and other supplements to support the immune system. What do you guys think? False. Lots of falses in there. You guys are right. So of course, these vitamins and minerals can help support our immune function. But again, back to that balance, more isn't always going to be better. Something like vitamin C, because it is a water soluble vitamin, isn't as much of a concern versus something like vitamin D, which is a fat soluble and it can store in our body a little bit longer. But generally speaking, we really want to stay with the regulations of the upper limits of all of these vitamins and minerals. For example, vitamin C, the upper limit for 19 years and older is 2,000 milligrams per day. If you're looking at a packet of Emergency, that contains about 1,000 milligrams. Plus, keep in mind, we're also taking some, having vitamin C in our diet as well. So it can be very easy to overdo these ranges. And again, certain vitamins are less of a concern than others are, but you really want to keep in mind that our body does like balance. So throwing it off with adding so much of something isn't always going to be a positive at the end of the day. And I always recommend talking to your primary care physician, especially if you're on different medications, because that can impact, their recommendations, or a registered dietitian as well. All right, true or false, 2/3 of the immune system is housed in the gut. What are we thinking? True, couple trues, a false. Okay, this one's a pretty mixed bag here, all right? So true, which is really, really interesting. A lot of physicians will refer to, or scientists will refer to the gut as our second command center. So it's really important in terms of immune function. A lot of the reasoning behind this statement is because a good amount of our healthy bacteria is housed in our gut. And those actually are responsible for helping to break down and utilize specific vitamins and minerals, which is pretty interesting. We have a symbiotic relationship, if you guys remember that wording, with our healthy gut bacteria and our body. All right, true or false? Eating a balanced diet, including fruits, vegetables, lean proteins, beans, legumes, and whole grains will support my immune system. What do we think? True, true, true. Yep. All right, this one was sort of a give me. A little bit of a segue into the rest of today's presentation. So yep, you're right. Incorporating all of these different food groups are going to ensure that we're having all of those vitamin and mineral MVPs. So there, all of this too, by the way, with all of the vitamins that I'm going to discuss, everything that's written on these slides is available to you guys. It's written on a handout, so you have it all after the presentation. So vitamin C, this is sort of the most popular vitamin that we think of when it comes to immune support. So It's most renowned for our support. Vitamin C, or ascorbic acid, you'll also see, is a water-soluble vitamin. Now, its role in the immune system is to stimulate the formation of antibodies, so that those are those proteins that help to fight off infection. Um, and sources, so citrus, bell peppers, kiwis, strawberries, tomatoes, kale, etc. Um, our recommended dietary allowances is around 65 to 90 milligrams per day for adults. So that means that if we're within this zone, we're getting a good amount. Some other really great sources, or something that most of us tend to go more towards, those citrus fruits, but actually our bell peppers and kiwi have more vitamin C than citrus generally does. Another really great source are cherries. So for a half a cup of cherries, you have about 822 milligrams of vitamin C. Some spices too, which is interesting. So thyme and parsley also have a good amount of vitamin C to offer. All right, so vitamin A. Vitamin A is a fat soluble vitamin. So that basically means that it needs to be paired with a fat source in order to be absorbed. It's known as an anti-inflammatory vitamin because of its critical role of enhancing immune function. So it protects the body against infections by keeping the tissues in the GI tract and respiratory system healthy. So respiratory system healthy is definitely something we want to think about, especially with COVID circulating around. Generally, the food sources are going to be most orange or yellow fruits or vegetables, leafy greens as well, and then also things like eggs or fortified foods such as cereal or milk. Our recommended dietary allowances, so the RDA is 700 to 900 micrograms for adults. So to put that into food perspective, I always like to give an example. 4 ounces of salmon is about 860 micrograms. A sweet potato would be about, for a cup, 1,836. So very powerful when we're thinking about how foods can really give us a lot of what we need versus a supplement. And again, to just back up in terms of the fat soluble portion of the vitamin, that's typically why, if you've ever seen on dressing bottles, they'll say helps to absorb the nutrients in your salad. That's basically what they're talking about, because lots of vegetables are going to contain these fat soluble vitamins, and we're having it with a dressing, or if we're having it with cooking oils, then we're really going to enhance the absorption via our body. So fat isn't always, we always look for the low fat dressings and things along that line. It is helpful to have that in order for proper absorption. So don't torture yourself with a plain salad, please. Put some dressing on it. All right, so vitamin D, aka the sunshine vitamin, which I think we could all use just about now in the dead of winter. So our body basically can make vitamin D from exposure to sunlight, is also a fat soluble vitamin. And basically, it regulates the essential and adaptive immune responses in the body. There's a lot of research right now with vitamin D and COVID, which we'll go into. Food sources are going to be your fatty fish, so like salmon, tuna, mackerel, eggs, as well as milk and 100% juices that are fortified with vitamin D. RDA is 600 to 800 IUs per day for adults. I usually like to go on the higher end in terms of vitamin D, especially just considering where we live. Generally speaking, if we were to get the necessary vitamin D from sun and sun only, that would be about 10 to 30 minutes of midday sunlight, more than 5 days per week. So generally speaking, again, because we live in the Northeast, we generally are coming in low. A good amount, or a good percentage of people that live in the Northeast are on the low end of vitamin D levels. So it is an important one. It's something that they can always add on to if you ever get some labs drawn in the future. Just say to your doctor, hey, is it okay if we just throw in a vitamin D panel? I'd like to see where that's at. All right, and then for food sources, so this one's an interesting one. Wild caught salmon, so 3.5 ounces of wild caught salmon is going to give us 988 IUs of vitamin D. Farm salmon, same ounce, so 3.5 ounces, only 526 IUs per day. So there is a pretty big dietary difference between the wild caught and the farmed. All right. Vitamin E. So again, another fat soluble vitamin and antioxidant. So its role in the immune system is to prevent damage from to the body from free radicals, which are basically unstable molecules that damage the body. So food sources are going to be our cereals, our sunflower seeds, almonds, veggie oils, such as sunflower, safflower oil, hazelnuts, and then natural peanut butter. Emphasis on that natural peanut butter. So basically on the back of that label, you just want to see peanuts, maybe peanuts and a little bit of salt. That's pretty much it. The RDA is 15 milligrams per day for adults. For example, an ounce of sunflower seeds, so about the inner palm of your hand, would be about 10 milligrams per day. All right. Zinc, another highlighted mineral that's going on in the news with COVID. Again, we'll talk a little bit about some of those studies. But zinc is an essential mineral. Our body does not make it. So we do need to get it from our diet. Most of the time, you're seeing people with normal zinc levels within the body. It's not a atypical thing to see. And basically, in terms of the immune system, it's going to fight off invading bacteria and viruses. It also works on healing wounds and inflammation. So food sources are going to be your lean meats, your poultry, seafood, milk, whole grains, beans, and seeds. And then your RDA with zinc is 8 to 11 milligrams per day. Now, this is one that I definitely want to just throw out there. When it comes to zinc right now, a lot of people are taking a little bit more than generally is recommended. So keep in mind, we only need 8 to 11 milligrams per day. I've had patients that are taking 50 or so milligrams on a daily basis from a supplement, and then plus whatever they're getting from their food. So we really want to stick to those recommendations. Again, they're set for a primary reason. Sometimes if people are having too much zinc in their diet, it can actually cause like severe nausea, vomiting, things along that line. So if you are somebody that is supplementing, definitely make sure you're taking it with food and really make sure you're watching the dosage on it. And again, always great to throw it out to your dietitian or your primary care physician if they feel that that's an appropriate dosage for you. So if we're dealing with food sources, 6 oysters would give us about 32 milligrams per day. 3.5 ounces of beef would give us about 4.8 milligrams of zinc, and a half a cup of lentils would give us around 1 to 2 milligrams. All right. So protein. Protein is a macronutrient. So it's one of the major building blocks of our body cells. Its role is generally for healing and recovery, and again, used as the building blocks for the cells that operate the immune system. Food sources going to be animal and plant-based sources such as poultry, meat, eggs, dairy, seafood, nuts, seeds, beans, soy, legumes. And generally speaking, we recommend people to try to stick more so to those leaner protein sources such as your poultry or your fish or beans and legumes. All right, and the last one's probiotics. So this is one that you don't really hear too much in terms of immune function, but it does play a really great role. Again, if you remember, 2/3 of our immune system is housed in the gut. So probiotics can definitely help with just supporting and reinforcing our gut lining. So basically, they're healthy living bacteria and they're going to help break down and utilize nutrients that support immune function. They influence the activity of our own immune cells. They regulate inflammation, barrier function, and cell-to-cell signaling. So they have multiple purposes in the body. We have already a good amount of bacteria in our gut. Scientists actually estimate it to be about 5 pounds in weight of bacteria that we have. There's good bacteria, there's not so good bacteria. We basically just want to make sure that our good bacteria is at a higher count than our bad bacteria is. So probiotics and probiotic food sources can help to kind of reinforce. You can think of them as, you know, army backup, where if you're introducing more of these food sources, it's just going to help populate more of that good bacteria. So fermented food sources are going to be the main food sources. So yogurt, kefir, kimchi, sauerkraut, kombucha, tempeh, things along that line, natto. And we can also get probiotics from a supplement as well. Those can be hit or miss in terms of what's living, what's not. There's a couple of brands generally that I recommend to patients, and I usually am not recommending probiotics unless there's some sort of GI issue going on, or if I feel it would benefit a patient in any other particular way. But you can definitely get a good amount going from fermented food sources. And when you look at the back of yogurts, they will tell you how many strains. So the more strains that you can find of bacteria on the back of a yogurt, the better that's going to be. More diversity in terms of good bacteria is always a good thing. All right, so with all of that said, and all of those, you know, macro, micronutrients, basically what it all boils down to is good old faithful MyPlate. So this is, if you're not familiar with MyPlate, it's generally one of the first resources that I'll introduce to my patients. It's going to be what we base a lot of our recommendations off of. This is actually what took over the food pyramid. So basically, in terms of just general recommendations, and again, this isn't based off of anybody's specific needs, but more of just the general population for adults. Fruits are going to be around 2 cups per day. A small apple, for example, would count as a cup or a serving as well. Vegetables, we want to deal with about 3 or more cups per day. And that's going to be sort of the unlimited food group. You really can't have too many vegetables. And it's definitely one of those things where my patients would tell you, sometimes it's tough to stick in. 3 doesn't sound so crazy, but 3 or more, when you're trying to really work on that, it takes a little bit of effort to really make sure you're getting that on a daily basis. Where research studies finds to be a great amount is actually anywhere between 5 and 8 servings or cups of vegetables per day. So I don't even hit that sometimes. It's definitely a difficult number to reach, but again, more is better in terms of vegetables. All right, so our grains, this is going to vary greatly by person, but on average, it's usually around 3 to 8 ounces per day. I usually refer to this as gas in the gas tank. So if you're somebody that's very active, you're likely going to need more grains and more energy to fuel your activity. If you're somebody that's a little bit more on the sedentary side, then you're not going to need as many grains in terms of your day to day. So it's really, again, one of those areas that's going to depend on the individual. Our dairy, about 1 to 3 servings of dairy per day. That's going to be your yogurt, your cheese, your milk, and again, around those 1 to 3, that's going to look like, for example, 8 ounces of milk, 6 ounces of yogurt, 1 to 2 ounces of cheese would be considered a serving. So when we say a serving, that's what we're talking about. And then for grains, actually, to back up, if you're saying to yourself, what the heck is an ounce? That would be a slice of bread or a third of a cup of any cooked grain like brown rice or quinoa, farro, things along that line. And then last but not least, our protein. So again, another group that's really going to vary greatly by person, but anywhere between 3 and 7, sometimes plus ounces per day. If you think about a deck of cards, that's about 4 ounces. So anywhere within that range on a daily basis. A lot of the times we feel like we really need to overdo this group, which again isn't the key here. Again, it's balance. So if you take a look at that plate, it's only a quarter of the plate. And we're getting protein, don't forget, from some other groups here. So grains will have some scant amounts of protein, and then dairy also is a significant food group that's going to provide some protein as well. And if you're somebody that's, for example, lactose intolerant, or dairy doesn't agree well for you, have a little bit of a sensitivity towards it, or you're plant-based, usually we'll recommend soy milk as the next best. Any soy-based dairy alternative products, because they're going to be fortified with calcium and vitamin D. All right. So basically our message is more colors are going to have more nutrients. This is actually a handout that we use for our pediatric patients, although I'm trying to get this into our adults handouts as well, just because I think it's really good for all of us to know how different colors can impact different parts of our body. Generally speaking, more colors, again, are going to warrant more of those nutrients. So sticking with the same thing every day isn't always the greatest thing. If you're switching it up on a weekly basis, that's perfectly fine if you like to meal prep and you have the same thing for a couple of days. But again, just really keeping in mind that colors and more of those minerals is what you're going to introduce. So really trying to look for a variety in your diet is going to be your best bet for making sure you're getting all of those micronutrients in. And there really isn't one fruit that's better than the other, or one vegetable that's better than the other. Basically, you just kind of want to think of it as they all work together. So the more that you can introduce is going to be the better. So kind of think of, eat the rainbow, and not, eat the rainbow in terms of Skittles, but eat the rainbow in terms of fruits and vegetables. All right. So a little joke in here. Don't be muscle Mike. I see this pretty frequently with my avid gym goers, not always, but sometimes, where they're meal prepping every single meal. And, it's a very standard diet of, their hard boiled eggs in the morning. And then for lunch and dinner, it's their chicken, rice, and their broccoli, which again, in terms of, a calorie basis, yes, might be hitting those macronutrients in your calories, but from a diversity standpoint and getting in all of those different vitamins and minerals, that generally is lacking with these folks. So again, trying to make sure that you're getting in that variety is going to be the best way that you're going to support your immune system. All right, so supplementation. This is something that we get asked a lot from our patients. So if you are a patient of ours, basically we will go through certain supplements or vitamins and minerals that we might feel are appropriate. Otherwise, we're not really big too much in terms of supplements. We always like to have a food first approach. And the reason why is because food and whole foods are going to have more of a synergistic effect. So basically what that means is when you're eating whole foods together, and just whole foods in general, you're going to enhance absorption, generally speaking. So they tend to be what's called more biologically available to our body, meaning that our body can really utilize them in a better fashion than most supplements would be able to do. And you're getting more things like fiber and other scant phytonutrients that you might not be getting from just a physical supplement. So whenever you can, definitely try to make sure you're getting the foods first approach. Something like a multivitamin, for example, there's nothing wrong with that. It's nice to just have that backup just in case you aren't getting everything you should be. But generally speaking, really thinking of this food first approach. And if you remember all of the vitamins and minerals that we just went through, not so difficult to get it from some of the food sources out there.
I agree to it. So as they peel the
Um,
shells, if you guys see the inside of a shell is different than the outside of the shell. The inside of a shell is very smooth, and that substance that they create to make it smooth is called oyster pickle.
I'm hearing
The same thing
something.
that they use to peel their pearls.
Oh, okay, there we go. I didn't know if anybody had a question. All right. So, in terms of our supplements, generally speaking, again, we would make this recommendation, or you can go to your primary care and find more information out. We use something called Full Script. So basically, if we do have a recommendation, our patients are getting a discount because it's practitioner grade supplements to the patient. Now, in terms of that synergistic effect of food, some examples would be, for example, vitamin C and iron foods actually help with absorption. So if you're having something that has iron in it and you're having it with a source of vitamin C, so for example, maybe some beef and a glass of OJ or some peppers, that maybe makes a little bit more sense. That's actually going to help the absorption of the iron in the body. Fat soluble vitamins, like we talked about with the source of fat, or pre and probiotics. So prebiotics would be more of your fiber foods like fruits and vegetables. And then if you're having probiotics, it's really going to help to make those probiotics have something to feed off of. So again, those foods working together. All right, so COVID-19 studies linked with nutrition. So one thing that I want everybody to keep in mind is COVID obviously is very new. So a lot of these findings are still very preliminary and rapidly evolving. So no firm conclusions at all at this point in time. So we get, as dietitians, the Academy of Nutrition and Dietetics will send us over these smart briefs on a daily basis. And COVID's obviously been some of the smart briefs. So this one in particular was on vitamin D deficiency linked to increased COVID-19 risk, which I'm sure some of you have heard about. So in this particular study, there was 489 participants with info, and they basically had information on their vitamin D status prior to COVID. So if they had, let's say, for example, vitamin D levels tested by their doctor within the past year, they were using that information. And they found that 22% of the patients with lower vitamin D or vitamin D deficiency tested positive for COVID-19 versus 12% of those with sufficient levels. All right, and then this one was on visceral fat. So that's going to be the fat that we carry around our abdomen area, linked to COVID-19 ICU admission risk. So this was actually a compilation of 6 different studies encompassing about 516 COVID-19 patients. And what they found is with those that were admitted to the ICU and were on mechanical ventilation that have that increased visceral fat, they were more likely to be hospitalized again in the ICU or mechanical ventilation versus patients that had lower visceral fat. They found that the patients with lower visceral fat actually were not hospitalized or not taken to the ICU. So basically a worse impact of COVID on those patients with higher visceral fat. All right, and then this one is on zinc. So they found that basically lower zinc levels were linked with higher inflammation and poorer hospital outcomes compared with patients who had zinc levels that were within normal limits. All right, and then other than diet, there's some other habits that can help in terms of our overall immune function. So I wanted to throw these in here too, just so we're not forgetting about them. So making sure that we're sleeping enough. We've talked about this a couple of times tonight. Adults need 7 to 9 hours of sleep per night. Children need 8 to 14 hours, depending on their age. making sure that we're keeping our stress levels at bay, which sounds easier said than done with everything that's going on this year. But we do know that increased stress can wreak havoc on our hormones, and it can also impact our ability to lose weight as well. So these are actually questions that we go through in our initial consultation with patients. So trying to seek methods like meditation, focusing on breaths, yoga, things along that line. Moving our body. So this is really supportive in terms of immune function as well. So we should be aiming for about 2 hours and 30 minutes of moderate intensity activity. So you can think of that if you can talk, or if you can't sing, that would be considered moderate intensity activity, and you can talk. If you are looking for vigorous intensity activity, that would mean you can't talk and you can't sing, and that would be classified as vigorous intensity. And so 1 hour and 15 minutes. So it would be either or of these would count as the requirements. And then last but not least, we know this by now, but staying clean. So proper hand washing and hygiene. And then another thing to bring up as well would be making sure we're washing our produce as well. So just water, we don't need to put anything else in there. Water, you could do a little bit of vinegar as well, and that should do the trick in terms of cleaning produce. So rounding out this presentation, I always like and encourage people to formulate a goal. So we use something called SMART goals. Basically what that is you're picking a sustainable, measurable, attainable, relevant, timely goal. So for example, if something that you got out of this presentation was, maybe I'm not eating enough vegetables, maybe we can start working on, all right, I'm going to aim for at least 2 servings of vegetables per day. And I'm going to try to do this for 5 out of 7 days. And basically, the more specific you can get with the goal, the easier that it tends to be to meet it, because you have a way to measure it. So anything that you took away from today, try to come up with a SMART goal and see how that goes for you. All right, so any questions, feel free to type it into the chat. Thanks so much. It was a pleasure presenting for you guys tonight. Again, my practice is the Right Bite Nutrition Counseling. We're located on Route 25A in Miller Place. Right now, currently, because of the pandemic, we're operating via telehealth only, and it's been really convenient for most individuals. They're able to have their appointments during lunch breaks and things along that line. So with the chaos of everything that's going on, it's been a little bit easy. If you need to contact us, this is our information here. We are usually posting recipes and things along that line on our Facebook or Instagram. So we're at the Right Bite Nutrition. And again, most individuals' health insurance will cover nutrition counseling. So that's something definitely to look into. And if it's not with us, any other dietitian. So again, try to choose a dietitian. All right, we have some questions. All right, so is it good to take fish oil? So yeah, if you feel like you're not getting in enough of those omega-3s throughout the day, throughout the week rather, so that would be around 2 to 3 servings of fish per week would be usually what's recommended. And then other omega sources, like for example, your walnuts, your flaxseed, your chia seeds, things along that line. If you're not getting enough of those, then I would recommend taking a fish oil. But again, you just want to check and make sure that you're running that by your primary care physician, because certain medications can interact with too much fish oil that's being taken. But generally speaking, it does have a good health effect. Do you recommend a particular probiotic supplement like Align? That's a really great question. So Align's really good. And then another one that I generally recommend is called Renew Life Probiotics. In terms of Consumer Reports, they tends to be up there. They're usually 1 or 2 on the list when they do the studies of having the most amount of live bacteria present by the time it gets to the consumer, which is something definitely to consider, because there are products out there where basically people are buying that are expensive, and by the time they're getting to consumption, it's basically dead bacteria, so it doesn't have much of an impact. So yeah, Align's great, and then the other would be Renew Life probiotics that I would recommend. Yep, Renew is a good probiotic. Somebody even mentioned it. You're welcome. You're welcome. Any other questions that I can help answer? Can be any nutrition related question. Looks like we're wedding. This is one of my patients. Yeah, supposed to get married in September. That didn't quite happen. So we pushed the date to May 30th. So whatever the situation is, we're just gonna get married. You're welcome. You're welcome. Thank you. Thanks so much. Thank you. It's been a pleasure, guys. Again, if you have any questions at all, feel free to reach out. We're a phone call away, an email away. You can also find some more information on the handouts as well. So don't forget to click on that link. I believe they sent that out. You can find it on the library website, I believe, as well, for today's presentation. So there's some recipes on there that are nice immune supporting recipes. And then there's the sheet in terms of immune function and all the vitamins and minerals summarized for you guys as well. Perfect. They linked it right there for you. All righty. Again, thanks so much for coming, guys. Looks like we're wrapped up unless anybody has any questions for me. I'm gonna hang out until around 8 o'clock, and if anybody wants to type in any questions, again, I'd be more than happy to answer. All right.